Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center, reporting for the week of December 13th, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. This past Sunday, we sadly crossed 800,000 deaths in the United States from COVID-19. I don't think anybody predicted that we would lose this many people in this pandemic, and especially when in 2020 we lost 350,000 people. We then got the vaccine at the end of 2020, and I don't think any of us would have predicted that now, with 2021 not even done, we already have over 450,000 deaths, so even more than we had in 2020. And so this is just especially tragic since now many of these were actually vaccine preventable. Here in Alameda County, we see that total daily cases are just starting to tick up. You can see out there to the right, those last few days will be continued to be updated as new cases come in. But even now, you can see that we are seeing a little bit of an uptick. And unfortunately, we're also seeing a little uptick in hospitalizations as well. So we will continue to keep an eye on that. Of course, nationwide, we are seeing increases across the country, with some areas already having hospital capacity issues. And so we are going to keep an eye on that. Here in California, we are already seeing upticks as well, and we have Omicron coming, which I'll update a little bit further in a moment. But in response to that, the state of California is also tightening up on some of our interventions, like mask mandates and some more strict guidelines around testing for large gatherings. And so I think we are all sort of preparing for the winter surge that we were already preparing for, but also now with Omicron on the scene, trying to get an assessment of what that is going to mean. And I think as part of that, my impression is that as part of that, the CDC recently expanded booster recommendations to 16 and 17-year-olds. So that is the Pfizer only, and it has now been expanded to 16 and 17-year-olds. This kind of happened without deliberation of any of the usual committees, the VRBPAC for the FDA, nor the ACIP for the CDC. They just went ahead and expanded the approval for this age group. And so don't have the benefit here of any sort of recommendation framework that was used, or head-to-head kind of risk-benefit calculations. But there does seem to be a sentiment, particularly with Omicron on the scene, that the booster will be needed in order to protect us against that variant. So definitely don't want to try to read minds as to why it happened like this. But I think the timing might suggest that this is really getting prepared for the winter surge that may include the Omicron variant. And by way of other good updates, I think, is regarding the monoclonal antibody treatment. So two kind of major updates, actually. One is that the emergency use authorization was expanded. Before, you could get monoclonal antibodies if you were 12 and up. Now all the way down to newborns can receive the monoclonal antibody treatment. Now this is for people who catch COVID, particularly those who are at high risk. So remember, that includes such a large number of conditions. It also includes obesity, includes race and ethnicity that have been shown to have higher case rates. So really, newborn and up who catch COVID-19, especially if there are symptoms, especially if we catch it early, and especially if there are underlying conditions, now have this expanded approval. and it is for the bamlanivimab and the atezolizumab, which are two of the monoclonal antibody treatments that have been approved now down to newborns. And the second kind of big news with the monoclonal antibodies is that there has been approval of a combination treatment and it's for pre-exposure treatment. And so this is actually for those rare instances where someone cannot be vaccinated or where they don't mount a good enough response to the vaccine. So this is really for those two categories of people. So one is immune compromised individuals who may not mount a good enough response to the COVID-19 vaccine. Or it might be those who, let's say, had a very severe adverse reaction to the COVID-19 vaccine and cannot then receive the next vaccine or the next one. And so they need an alternative option to prevent them from catching COVID. So this is not going to be for people who just choose not to take the vaccine, not going to be eligible. So it really is for this group. It's every 6 months. But this could really be a life changer for those who are right now scared, concerned, can't get vaccinated, or don't mount a good response to the vaccine. It's called Evusheld. And this is, again, pre-exposure prevention that is given by a intramuscular injection. And it is, so it's not for someone who has COVID, it's not for someone who's even been exposed to COVID, it's actually for someone who has neither, and it's pre-exposure prevention, and it lasts for 6 months. So that is other big news, particularly for those relatively smaller groups of people, but still very significant. So moving along to the Omicron variant. So this variant, as you know, was identified on November 24th, so it's been about 2.5 weeks. And it has spread rather quickly across the globe. And it's difficult to know just how quickly because we have very variable rates of gene sequencing or really trying to identify this. And so we're just kind of getting information piecemeal. The UK, which really does do a pretty good job of sequencing and keeping up on these things, has noted that they are seeing a large increase. It's concerning them very much. They are putting in some rather strict measures at this point in anticipation of a severe wave of the Omicron variant. They've got 10 people in the hospital already, and one has unfortunately already passed. And this might not sound like a large number, and it's not a large number, but the fact that we just learned about what this was 2.5 weeks ago and already have a death, this is actually fairly quick. And even having already 10 people in the hospital also, it just brings that concern that what will we see next? Because what they're seeing is that the Omicron variant is doubling at a faster rate than we thought. So every few days. And in some other countries like Norway and Denmark, they're seeing it doubling even quicker than that, in less than every 2 days. So when it's doubling at that rate, it really does start to bring concern. Now, the other thing that's been happening, which is pretty impressive just in this short time, is that there have been a lot of studies that have come out. There are a number of different kinds of studies. They're all mostly pretty small, so it's still kind of a trickling in of information. But what we're seeing is that there is sort of reduced protection, both from prior infection from COVID-19 as well as vaccination against COVID-19. So this is, of course, not reassuring at all. But the way that they were looking at this and the kind of range that they're seeing is still so wide that it's hard to really draw great conclusions. So there are those that are looking just at antibodies, and those have reduced significantly against Omicron compared to if you had the antibodies against the wild type or even Delta. But the range is like anywhere from a 5-fold drop to a 40-fold drop, and these are different kinds of studies, so I'm not going to go into too much detail on any of them other than to say it looks very clear that the 2 doses of vaccine is much, much less effective against Omicron than against the Delta, especially when we're looking at the antibodies, or the ability to sort of neutralize it. Now remember, that next line of defense is our T cell immunity, and there have been some studies that look a little better and look a little more reassuring that show us that the T cell response is still should recognize the Omicron. The Omicron variant has not evolved so far away that it is completely escaping our cellular immunity or our T cell response. But it still does look decreased. And then when we look at infection-acquired immunity, so someone who had Delta or a wild type, that their protection also dropped. And again, a huge range, anywhere from 2.5-fold drop to a 30-fold drop. So that's just such a huge range. But either way we look at it, it does appear that either prior infection or 2-dose vaccine just isn't enough. And so we are back to recommending boosters. And so I know that when I reviewed boosters here before, it has been pretty much a no-brainer that if you've got underlying conditions or if you're 65 and up, that you should definitely get the booster. But if we are thinking about protecting ourselves against Omicron, which is on the way, then we may all like to consider getting a booster. So, and there's some experts that are even saying waiting 6 months is too long, but that is the recommendation, is 6 months. So if you're more than 6 months out from your vaccination, then it is looking like that is not going to give much protection against this Omicron variant. Sorry to say. So this part is not very good news, but I guess the good news is you can get a booster. And that is what is looking like is going to be the recommendation. And if you've had prior infection, I think that we know that it does confer some protection, but it is looking like if your prior infection was against Delta or even the ones before it, it's just not enough. So you will also need to get the vaccine to get that protection against the Omicron. There's not enough data now to say if you should have 1, 2, or 3 doses. I think that the strict recommendation is the 2 doses, but there's definitely some suggestion that hybrid immunity, so having had the infection and the vaccine, is providing good protection. We just don't know exactly. We can't really quantify all of that yet. So with all of that being said, it does look like boosters are going to be important, and then also all of the other interventions that we know are important are still going to be important, and probably even more so important with the Omicron. So what about, is it more virulent? It's still, I think, way too early to be able to say this for sure. We've had sort of a skewed view so far, where more of the people who've gotten it, or at least more of the people that we know about that have gotten it, are going to be in populations where we've tested it. And so right now we are having a little bit of this issue where we tend to be testing more travelers. They are typically vaccinated. They're probably, more, young and healthy, moving around for the most part. So the real test is going to be once it really starts to spread around, that we see how it is impacting people who are maybe elder, maybe people with underlying conditions, and so on. So we just don't have enough yet to say. I think we can say that it doesn't appear to be orders of magnitude more deadly, thank goodness. I think that we might have seen that earlier if that was the case. So at least that's good news, but I don't know that we are ready to just be reassured and say that it is less virulent at this point in time. The other thing that I don't think we can say is whether it's going to replace Delta or whether it's just going to exist alongside Delta. So initially, I think we were thinking that it might be more like a Delta situation where Delta came in and it just outcompeted everything, and then all we were dealing with was Delta. There is some concern here that because Omicron has kind of mutated a little far away from Delta, that they each might be able to have their own little environment to exist in. So don't know yet if that will happen or how that would happen, but being that we're already getting into another Delta wave in many parts of the country, and then with Omicron coming, we are going to just be keeping an eye on this. So there's kind of no reason at this point, unfortunately, to think that we won't be dealing with both Omicron and Delta simultaneously. It may kind of select for its own population. So in other words, Delta is still seeking its available hosts, which are mostly those who are unvaccinated and who've never had COVID-19 before. But then Omicron comes along and it may be infecting everybody equally. So right now, when we look at how transmissible Omicron is, what we're seeing is that it's just about as contagious as the original one was when nobody was vaccinated. So again, this is not great news, and our best line of defense in terms of being protected is going to be the boosters, but also we should be thinking about doing what we can to mitigate spread, just like we were early on, for the reasons that I just mentioned. So we could be looking at a surge of both coming up. And we should also be paying attention to other countries like England, like Norway, like Denmark, that are similar to the United States in terms of having pretty high vaccination rates relative to other parts of the world. Also, they're pretty close in terms of the average age of the population, and they are much better than us in terms of their genomic sequencing, at least up until now. And so if we see that there are rapid rise of cases, then we should be keeping an eye, because we know that that is then followed by hospitalization, and that is then later followed by death. And there's really no reason for us to be thinking that we're going to be any different than any other part of the world, and particularly those parts of the world that, for the reasons I mentioned, are similar. And the other thing I just want to say about the Omicron is that even if it is less severe, which I know we're all hoping that it is, we don't know yet, but even if it is, the concern is that if we get huge numbers of cases, then even if only a smaller number of cases are severe, we could still end up challenging our hospital capacity and our ICU capacity, and we could just be in for more disability and death. And so even if it's less severe, less virulent, but way more people get infected, either because it's just more contagious or because it evades the immunity that we've developed from the vaccine or from prior infection, then we could still end up with a wave that was as bad as last year. And this is why I think California just recently implemented these stricter guidelines around masking and around testing before events, because we're attempting to really double down a little bit on the interventions that we know work, because we want to see what we can do to flatten that curve, not only of cases, but really flatten the curve of hospitalization and flatten the death curve as well. So for now, we want to just continue to make the safest choices that we can and use the best tools that we have. And I will mention again about the rapid tests. If this is something that you can get your hands on, I would suggest it. It's just another tool in our armamentarium. Remember that pre-gathering antigen tests can give you peace of mind up to the minute and let you know that you are not at least heavily contagious that day. So kind of a day clearance, if you will. If you're exposed to COVID-19 or you get symptoms, you should perform that test right away. And it's just an easy place to start if you have symptoms or exposure. If you have exposure to COVID-19, we still are recommending that you quarantine and just get the PCR test. If you are going to try to use an antigen test in the setting of post-exposure, you really will need to repeat it every 1 to 2 days for 7 to 10 days. And in all cases with the antigen test, if it's positive, believe it, isolate yourself, tell your contacts, and look into your treatment options. If it's negative, though, you're going to quarantine yourself and you're going to get a PCR test or repeat that antigen test every 1 to 2 days. And it may be time to sort of rethink all of the plans that you might have for the holidays and just see how you can make them safer. So that might mean everyone get tested before we gather. Might mean that you're not going to gather with certain people. And I know that these are always awkward and difficult conversations to have, but that's okay. I think we've all had to get into each other's business a little more than we would ever want to. But I think we all understand that this is for the safety of not only one another, but then the others that we all go around, and just for our community in general. And so it's okay to have a little bit of uncomfortable conversations, especially when we know that it is for the purposes of the greater good. Outdoors is always going to be safer than indoors. We know that with the weather being what it is right now, more folks are moving inside. So, see, can you at least crack open a window, crack open a door? Those CO2 analyzers can be really helpful for you to see what a difference those little interventions can make and if you need to do more. We also know that shorter time with others is safer than longer time. I've been talking to a lot of folks that have their places of worship reopening, and very impressed that many of them have found a way to make that service shorter, keep that ventilation going. Having a registration or sign up so that you know who all is in there. So in the event that someone catches it, you can call everyone. And maybe this also may be a time to go ahead and do those virtual services again, virtual gatherings again, particularly as we are in a bit of a moment of uncertainty. And then don't forget your booster. It should give a nice boost of immunity, either for those who've already had their primary series or people who've had COVID-19 before and haven't been vaccinated. Please go ahead and consider getting this booster. It should give you a good response right away. And it is something that we want to consider an important part of our armamentarium. Also, now with vaccination being available for 5 and up, we still have pretty low vaccination rates for our young people, and we've now seen that there are no safety signals with over 5 million doses having been administered, no myocarditis. So please do think about everyone in the family who is eligible 5 and up to get vaccinated so that we can create a better wall of immunity against all the variants of COVID-19 that we are dealing with. And don't forget to eat a healthy, balanced diet, quit smoking, reduce alcohol, consider a multivitamin supplement, and additional vitamin D supplementation, manage your stress, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you for joining us, and we'll see you again next week at 10 a.m. on Tuesday. See you then.